Hugh, if you will go first, if you'll introduce yourself for our guests, please.
Hi, my name is Hugh Ferguson. I'm a first sergeant with the Rockbridge County Sheriff's Office. I have 28 years in law enforcement in our community. And currently, I work as a school resource officer at Martin River Middle School. I had prior worked many years ago as the first school resource officer at Rockbridge High School. And I am a combat veteran of the U.S. Marines. And I have lived here for about 28 years. I'm from South Carolina.
Thank you. Dr. Kornegay?
Yeah, good morning. My name is Laura Carnegie. I'm the health director for Central Shenandoah Health District, and that includes Rockbridge County. The territory spans from Rockingham in the north to Rockbridge in the south and west to Bath and Highlands, and I'm excited to be a part of the prevention forum, so thank you.
Sally?
Hi, my name is Sally Goodquist. I work for the Virginia Department of Health. I am a tobacco control coordinator for the Northwestern region of Virginia. So that covers the Central Shenandoah Health District, which you all are in, and then 4 other health districts. I'm based in Charlottesville, and since the pandemic, I've been reassigned, so I don't get to do as much tobacco prevention and education as I used to. I'm now doing hotline work for COVID response in the Thomas Jefferson Health District, which covers Charlottesville and the surrounding 5 counties. So I'm really happy to be here talking with you all about both topics, I guess, today.
Great. Thank you, Sally. And thank you, panelists, for joining us today. So our first conversation, or our first question today, is going to be probably a pretty simple one, but in case people have not heard of vaping, our first question, and Hugh, I'll direct this at you, is what is an e-cigarette, a vape, a Juul, or new to the market, a puff?
It is an electronic device, battery operated, that uses a liquid, usually a flavored liquid nicotine product. So instead of actual smoking of a tobacco, it's vaporizing the liquid into a vapor that people inhale to basically smoke. It was supposed to be used or invented to try to curb people off of the habit of using tobacco and smoking, but it seemed to me to be marketed towards younger people, and it really exploded when the Juul, which became the most popular e-cigarette, came on the market a few years ago. It really exploded across our country, and the numbers really went up high as far as the use of that kind of device.
All right. The e-cigarette in general, Sally, if you will respond to this question, there's some confusion in whether all vape products actually have nicotine in their juices or liquids.
Yeah, so it's difficult to tell because the industry as of yet is completely unregulated. So the FDA is in the process of receiving and reviewing applications that actually would authorize vapes to be on the marketplace. So technically they are legally available right now because they haven't been approved by the FDA. So it's really hard to tell when you purchase any kind of vaping device or any liquid that goes into them, how much nicotine it actually contains or what's in it at all. But so what we know about what's in the e-liquid that's used in vaping devices is from studies that have been done in laboratories that actually analyze the liquid. And most of the products do contain nicotine, even if they say that they don't, because they haven't had to prove necessarily that their ingredient lists are accurate. So most vaping devices, and especially something like a Juul, like Hugh mentioned, always contains nicotine. And then, of course, there's also the possibility of there being THC in them as well, and lots of other chemicals, which we don't know yet about because, again, the industry is unregulated. So they, even if they have an ingredient list on them, which they're not, required to yet, it doesn't necessarily mean that it's accurate.
Okay. Dr. Kornegay, your comments?
Yeah, I think one of the disturbing statistics, when you look at surveys of high school students, is that about 60% of them feel like the products that they're buying over the counter are just flavored without nicotine. So, the overwhelming majority of kids feel like there isn't nicotine in those products, although, as Sally and you pointed out, the majority of them do have nicotine.
Okay. Now I do, just for some clarification's sake, are all of these devices, as you call them, Hugh, are they all the same thing? Do they have different looks? Or, what, is there something specific I should be looking for? If, in
Yeah.
my child's bag or something like that, what should I keep my eyes open for?
Yes, well, the older models, kind of looked like a smoking device. They seemed to be larger. They kind of stood out if you saw them. The Jewel came out, and they, I believe purposefully designed it to look like a memory stick, and it actually charges on a computer with the memory with the a computer port to charge it. So it is completely camouflaged if you don't know what you're looking for. The cartridges are very small. They're even there's clothing lines with hidden smoking devices hidden in the clothing, or there's clothes now that are marketed for children to use so they can hide the device better. Uh, for instance, if they were using it at school. So you do have to be very suspicious and look carefully to try to identify them. Of course, you
Okay.
can go to a store and see them and kind of get a good mental picture of them. But most of them now are made to be fairly discreet.
Okay. Dr. Kornegay?
Yeah, a lot of these devices, I think, use point as well taken, look a